Good afternoon, everybody. It is certainly my pleasure to welcome each of you today to this very important occasion as we officially launch the strategic plan of the BVI Health Services Authority. I will begin by recognizing our distinguished guests. Join me in welcoming our Deputy Premier, Honorable Julian Fraser, and Acting Premier, as our Premier is on travel duty. Put your hands together as we welcome Honorable Fraser. I would like to welcome the Minister for Health and Social Development, Honorable Vincent Wheatley. Welcome our Junior Minister, Honorable Luz Hodge Smith. Honorable Smith is going to beat me up afterwards. Welcome our Speaker, Deputy Speaker, Honorable Carl Dawson. Would also like to welcome our Permanent Secretary, PS Tasha Bertie, and our Deputy PS Smith. Put your hands together for them. We have some lovely folks that I want to specially recognize, our ambassadors. You will hear more about them. I want to recognize Violet Gall, Rosemary Flax, and Jovan Klein. They're our ambassadors here with us today. Chairman of the BVI Health Services Authority Board, please help me welcome Ron Potter. Acting Chief Executive Officer, Dr. June Samuel. Other members of the BVIHSA executive. Also special welcome to the entire KPMG team. They've been working really hard with this strategic plan, and so we officially welcome you. Other valued partners, stakeholders, BVIHSA staff, good afternoon and welcome. We look forward to sharing the vision, the priorities, and the pathway that will guide our work in the years to come. Once again, thank you for being here. And I'm going to start by welcoming our we're going to start with a word of prayer. So I'm going to put our first ambassador to work. Put your hands together for Pastor Jovan Klein.
Good afternoon, everyone. May we briefly stand for a word of prayer, please. Thank you so much. Heavenly Father, thank you for this opportunity, God, to come together, to be productive, Lord, to create good progress and to do something with great excellence. Thank you for this opportunity to serve, and as we go forward, Lord, we pray that each member here would be inspired by what this great team is laying out and what will come in the near future. Let your grace, let your favor follow us as we go forward with faith. In the mighty name of Jesus we pray. Amen.
Thank you, Pastor Klein. Ladies and gentlemen, this gentleman has been at the root of our efforts. He has continued to support the BVI Health Services Authority and is championing the development of healthcare across the territory. Put your hands together and help me welcome our Minister for Health and Social Development, Honorable Vincent O. Wheatley.
Thank you. Good afternoon, everyone. It's quite an honor to, in the same week, give remarks at the inaugural session of the medical school, and in the same week or the week after, to give remarks at a strategic plan for healthcare. This is in keeping with SDG number 3, healthy communities. So we are keeping up with our UN goals right here in the territory. That was said by the chairman. I am Honorable Vincent O. Wheatley, Minister for Health and Social Development. The BVI Health Service Authority's strategic plan is a timely and important milestone in the advancement of healthcare across the Virgin Islands. It is also a bold and necessary step forward as we chart the path towards a healthier and more resilient Virgin Islands. As Minister for Health and Social Development, I view this plan as a vital tool to ensure that our health services continue to meet the growing needs of our people. This body of work being launched today reflects more than just months of planning. It reflects the voices of the people we serve, the experiences of the professionals who care for them, and the insights that have shaped our vision for this organization. Above all, it represents the future we aspire to build. The development process has been rigorous, evidence-based, and deeply collaborative. Guided by internal and external analyses, stakeholder engagement, and global best practices, we now have a clear and comprehensive roadmap designed to bring the strategic plan for the authority to life in a way that is practical, focused, and impactful. This is just not a report, it is a framework for transformation. The strategic plan boldly addresses the real challenges within our health system and puts forward 9 strategic priorities that serve as pillars of transformation, from stronger governance and smarter care delivery to digital innovation, workforce development, and modern infrastructure that will benefit generations to come. It outlines clear, measurable goals, such as expanding equitable access to care, improving air quality in our facilities, strengthening telemedicine across these islands, and embracing financial sustainability through diversified revenue streams. With over 200 stakeholders' engagement, the plan reflects a deep, inclusive dialogue with our communities, professionals, and partners, making it not only visionary, but deeply rooted in the needs and voices of all people. I want to highlight that this plan does not merely address the what, but it goes deeper into the how. It details how we will build institutional resilience, how we will optimize resources, and how we will place people, our patients, and our staff at the center of everything we do. We know that change doesn't happen overnight, but with clear direction, dedicated leadership, and a unified commitment, we are confident that the implementation of this strategic plan will produce measurable, meaningful results. The Ministry of Health and Social Development will prioritize collaboration and accountability to ensure this plan leads to measurable improvements in healthcare outcomes. As Minister of Health and Social Development, I want to assure you that my ministry remains committed to supporting the BVIHSA in achieving its goals. At a policy level, we will continue to work towards strengthening the legislative, financial, and institutional framework necessary for improved service delivery. I wish to extend my sincere appreciation to all who contributed to this effort: the board, the interim CEO, the dedicated team at the authority, our stakeholders, our community partners, KPMG, and the many professionals who participated in the consultation process. Your contributions were invaluable, and your dedication is truly commendable. Today marks more than the launch of a strategy. It is a commitment to progress, accountability, excellence, and most importantly, to the people of the Virgin Islands. I want to acknowledge our Deputy Premier and all the cabinet members and all other dignitaries here with us today on this momentous occasion. Let us move forward with intention, clarity, and purpose, united in our commitment to building a healthier Virgin Islands. Thank you for listening.
Thank you, Honorable Wheatley. One more time for Honorable Wheatley. Thank you for your remarks. Another gentleman who is at the helm of the Board of Directors, or Chairman, Mr. Ron Potter. Please put your hands together as we welcome remarks from Chairman Potter.
Thank you, Master of Ceremonies. Deputy Premier Fraser, Honorable Vincent Wheatley, other members of government, CEO June Samuels, other dignitaries, BVIHSA team, and the rest of the protocol that's already been established. Good afternoon and welcome. Welcome to the launch of the strategic plan for the BVI Health Services Authority. The BVI Health Services Authority must work for all Virgin Islanders and visitors who will need it as patients for healthcare at all stages of life. The authority must work across all our communities, especially in the Sister Islands and the non-Road Town communities, across major disease categories such as cancer, mental health, and cardiovascular diseases. It must work for us as an employer, it must work for us as a business partner, and it must work for us as an important institution in our nation building. Unfortunately, the authority currently does not work as Virgin Islanders would expect. And as such, the Board of Directors in March 2023 embarked on a journey of discovery to fully understand why. So coming out of this journey, it is the board's honor, it is my honor to introduce the authority's strategic plan, a blueprint for transformation, sustainability, and excellence in healthcare over the next 5 to 8 years. This strategic plan represents a pivotal opportunity to realign and refocus the direction of the authority, ensuring that we remain responsive to the needs of our people while adapting to the dynamic nature of healthcare landscape. In collaboration with KPMG and through meaningful engagement with stakeholders across all levels of our organization and communities, this plan outlines a bold yet practical path forward. The plan also places critical emphasis on customer service, patient satisfaction and well-being, and the development of our most valuable assets, our people. But I'm also pleased to say that the authority has already started to execute on this strategic plan. The plan will be supplemented by other efforts we are making, and one of the main efforts we're making is a forthcoming compensation review and job reclassification exercise to look at the compensation structure and recommend one that's more aligned with the market to help with the retention and the recruitment of all our healthcare team members. Another area is the existing alliance agreement, which governs how the HSA is compensated through the National Health Insurance for the agreed basket of services that it provides under a global budget. This global budget under Phase 1, which was only intended to last for 1 year, has been in place for the last 10 years, contributing significantly to our current challenges. Through the work of the Contract Management Committee, we are now in the closing stages of a new alliance agreement, which when implemented is expected to be the first step in improving the authority's financial position. And we are looking forward to moving to Phase 1 under that new alliance agreement on January 5th, 2026. Another important agreement to address the financing is one for what we call non-covered services. Services that are provided outside of the NHI basket of services, such as pre-hospital care, long-stay patients, the uninsured, and National Public Health Laboratory, to ensure that the cost of these services are paid for. Separately, we propose establishing an endowment fund to aid in the financing, the development, and the maintenance of our capital infrastructure and the purchase of our critical equipment once we've completed a capital life cycle plan and a biomed review. We've entered into an agreement with the RDA to build out our capital infrastructure once financing is secured. We have a new business development function and a refreshed marketing department that are very engaged in fundraising and developing new service lines and refreshing existing service lines. We are setting up a charitable trust, seeking 501c3 a status to provide tax deductions for U.S. donors. And we will be reaching out to engage community members who are interested in helping us with this. We are updating our clinical services plan to help guide us on the clinical and support services that we provide out of each community clinic and each floor of the hospital. The services the authority provides must meet the needs and the expectations, where feasible, of our various communities. And one key area for us is to ensure regular access and physical and service upgrades to our community clinics. Other areas are our private wing at the hospital, dental services, mental health, cancer care, telemedicine, and physiotherapy. Coming out of the strategic plan, we'll expect a new organization chart that aligns the skills that are needed in order to execute on the strategic plan. We are filling out the management positions that have been filled in an acting capacity or have remained vacant over the years. Other examples of our efforts are the renewal of our accreditation status and our Red Loud preventative campaign for kidney disease, diabetes, and high blood pressure, which was introduced in June. Today, we are also launching our ambassador program for community advocates and a new website and patient portal for access and efficiency. For these various efforts and the launch of the strategic plan, I extend appreciation to, first and foremost, my fellow board members, CEO, Dr. June Samuels, and the whole authority team, the minister and the ministry, and especially to KPMG for their guidance, and to all stakeholders who contributed their time, insights, and passion throughout this process. Together, we have charted a course that is ambitious, actionable, and aligned with the national vision of a healthier Virgin Islanders. Let us now move forward, united in purpose and guided by a commitment that only excellence counts. Thank you very much.
Thank you, Chairman Potter. Chairman Potter is keen to ensure that, for those of you who are not aware, enough work going on at the BVIHSA, so he just gave you a full report. Give him another round of applause. It is also my pleasure to welcome this gentleman who has been intricately involved in the development of the BVIHSA strategic plan, Head of Healthcare, KPMG Islands Group. Please welcome Dr. Ed Fitzgerald.
Honourable Ministers, ladies and gentlemen, good afternoon. It's a pleasure to be here this afternoon. My name is Dr. Ed Fitzgerald and I head up healthcare work for KPMG right across the region. And I see someone's just managed to tuck in the little flag of Bermuda in the corner. I am based in Bermuda, so it is also a real pleasure to be supporting one of Bermuda's sister islands in this work. Now, I think I should probably start with a little bit of clarification. There's been a number of mentions of KPMG in this work so far, and I think many of you will understandably associate KPMG with our traditional financial services work, but our team are a little bit different. My background is as a doctor, and together with Penny and Julianne, who are here, our sole focus is on supporting healthcare across the islands in the region where we work for the benefit of our own island communities. So it's a real pleasure to be able to support the work here in BVI around this topic that we've been working on. Now, in recent months, we've been helping support this, really bringing focus to help align, to interview, to run workshops, to bring stakeholders around the table, to visit clinics, to run surveys, and really get a full voice, a full perspective from people to help inform this plan. And we've also helped develop a number of supporting pieces that sit behind this as well, thinking particularly about the implementation plan and also particularly around the jurisdictional scan, comparing healthcare in different jurisdictions. And it's that point that I'd just like to spend a few minutes to reflect on today, to think about the situation of healthcare across the islands and perhaps more widely globally where we're working. I think it's really important to say that there isn't anywhere in the world today, sadly, that isn't facing challenges with healthcare. Everywhere is seeing shortages of healthcare workforce. Everywhere is seeing rising costs of healthcare. And so islands really bring a focus to that. I often say they apply a magnifying glass because it really brings into sharp relief the need to be able to support healthcare in an island setting. And I think healthcare in island settings is more nuanced. It can be more challenging. There are also more opportunities. We see in many of the islands where we're working a real uniting focus of the community behind healthcare. Health is wealth. And healthcare has a value, not just a cost. And those are really important guiding principles that I think different island communities do appreciate. So it's against that backdrop of some of the challenges and difficulties that we've really reflected on this work. And we've helped develop strategic plans for a number of different islands across the region. But one thing I really want to say today is how impressed we have been with BVIHSA and the bold ambition that they're taking in setting out this work, in bringing the stakeholders together and really working hard to get everybody on the same page to agree the priorities going forward. And I think it's also really, really important to say that of all the many islands we work in across the region, by far and away the majority do not have a strategic plan in place like this one that has been developed for BVIHSA. So I really commend them for embarking on this and taking this work further forward. Now, I think for any organisation launching a new strategic plan, it really is an important milestone. And I think it's great that we're coming together to celebrate this today because it really is worthy of celebration. It's an opportunity to renew relations with stakeholders and to refresh relationships with the community. But most importantly, it sets out a clear way for everybody to pull together and to move forwards in the same direction to achieve the goals that everyone has now agreed are the priorities. And that's really important and to be commended. And I think also it's worth reflecting that while this is a major point of celebration, I often joke a little bit that the hard work is only really starting now. The purpose of the strategic plan is to enable that delivery. It's to bring those people onto the same page, to set the priorities, to be able to understand what's required for implementation. But the hard work to deliver that is what starts today and follows. And that has already started in many of the work streams that are taking place. So with that, I would like to thank everybody who has been involved. I'd like to thank our own KPMG healthcare team, who bring so much of their island expertise from the islands we're working in. But most of all, I would like to thank the many, many HSA stakeholders and stakeholders beyond the community who have given us their valuable time, their valuable experience, and the benefits of their perceptions to be able to encapsulate this in the plan that we've developed and you're launching today. So I very much commend this plan to you and congratulate you from the steps you've taken to deliver this. And we very much look forward to supporting you in the weeks and months ahead as delivery begins. Thank you very much.
Thank you, Dr. Fitzgerald. Now, Dr. Fitzgerald mentioned that the hard work is ahead of us, and that is in fact true. But something he said I would love to highlight, and is that when you think about the challenges globally, compared to most, we're doing a good job. Give BVIHSA a round of applause. And also, sometimes when you read the blogs and listen to people like Violet on Talking Points, you would think that all is not well with the BVI, but we're doing good. So give BVI a round of applause. At this time, it is certainly my pleasure to welcome our acting Chief Executive Officer, Dr. June Samuel. And Dr. Samuel's job is to officially introduce the new BVIHSA strategic plan.
Acknowledge the protocol already established. Good afternoon, everyone. So, we have a little switch here. The Bible in Ephesians chapter 5 warns us about time, guarding our time, being good stewards of our time as we carry out our purpose in God's kingdom. 3 years ago, I assumed the role of CEO, and I did so without hesitation. During those 3 years, a lot of us were impatient about change. We wanted change to happen now. But if we are laser focused in managing our time, change will come. During those 3 years, we ensured that critical operations continued. We took steps to take us on this path to where we are now. We maintained our accreditation. We advocated for budget adjustments. We provided a transparent process to our patients and their families to give us feedback. We get more feedback now than we ever have gotten before. And we began the process of increasing the menu of clinical services that are available here at BVIHSA. But for any business to be resilient, there must be a plan. At our Christmas function, those of you who are here, you would have heard me say that transformative change is coming to BVIHSA this year. You remember that? Yes, Mr. Honorable Weekly shaking his head. That time is now, and we're setting that in motion today. May I remind those of us who are impatient that transformation is a process. It's a process that takes place over time, and therefore this strategic plan is an 8-year roadmap reflective of months of collaboration, listening, honest reflection, and it is shaped by the voices of our staff, our patients, and our partners and our communities. It is the roadmap. I've been saying this since yesterday. This now becomes our Bible at BVIHSA that will allow us to build a health authority that leads with purpose, delivers with excellence, and puts people at the center of everything that we do. In the BVI, we are people that go big. We go big. When the act was passed in 2004, the then Honorable Ronnie Skelton intended big things. Hence, we have the best hospital facility in the Caribbean because we intended for big things. Give ourselves a round of applause for that. People come and tell us that all the time. KPMG will tell you that too. So fast forward and here we are. And in case you're asking why now for this plan, it is simple. We have to rise to the challenges of provision of healthcare in the current economic climate, which is happening internationally and locally. And otherwise, we must provide modern and relevant care for this era, for our community. Relevant care for our community. And that will only be done with bold transformation. Our vision for the strategy, this vision aligns with the National Development Sustainable Plan. For those of you who have read it, if you haven't read it, you need to pull it out. The goal for health, as stated in there, by 2036, is for a fully healthy population, inclusive of health systems working for all Virgin Islanders. At BVIHSA, therefore, We will strengthen the health and well-being of the Virgin Islands through a resilient, accessible, and equitable BVIHSA. We are committed to building a future-ready organization by prioritizing person-centered care, wellness, and prevention, and empowering staff and communities, and also deliver safe, consistent, high-quality services at all levels of care. We can do it, we have been doing it, and we will continue to do it. We will achieve the delivery of seamless, transparent, and sustainable healthcare through innovation and collaboration. And you're going to hear about some of those in the pillars that we present to you today. We invite you to partner with us on this journey in a supportive way, knowing that transformation, while not painless, results in real and tangible change. I thank you.
Thank you, Dr. Samuel. And please put your hands together as we welcome our Director for Hospital Services, Mrs. Pat Malone-Smith, and she's going to take you through our journey to date. Please put your hands together.
Good afternoon, everybody. I acknowledge the protocol already established, and my job is to talk today about how did we get here. Back in September, October, we decided that we needed to work on getting our strategic plan because it's been 10 years since we'd had one before, and we'd been sitting without a strategic plan. And I'm going to quote, like Dr. Samuel, something from the Bible says, "What is the vision? The people perish." And you have to have a plan. If you don't have a plan, where are you going? So that's one of the things the strategic plan will do for us. So we decided to send a request for proposal out. We received six companies replied. And we formed the committee, reviewed everybody, and KPMG was chosen because they demonstrated to us that they had done this work before, could engage the people well to get it done, and then some of the other people were looking for an opportunity to do their first strategic plan. And we didn't particularly want to be your first trial at this because we want this done right. My position has been, since I started 16 years ago this month, is when we leave it better than we met it. And that's what having a strategic plan is going to do for us. So then we chose KPMG. They came on board, and it didn't click for me till yesterday. We've been at this for 7 months. They come, they go, they call, meetings every Thursday. And then again on Monday, because you're like, we have missed something on Thursday, so we need to cover it Monday. So we had these meetings. They came in. We went to the community. We went to the clinics. We invited people in to hear what they have to say. What do you want your healthcare to look like? That's one of the plans, one of the purposes for this strategic plan. It's not done in a vacuum where we think this is what you need, so this is what we're going to give you. We wanted to be able to give you some of what you want while we give you what we know is right. So that's where we are now. So we're now at the place where we are launching, and in the next 4 to 6 weeks, we will start implementation. So this is where we are. We're excited to be here. Our hope, our prayer, our wish is that everybody that's present will continue to support as we move forward with this. There's going to be there's expenses involved, so the ministry is aware. The communities have to be aware and come alongside, because you cannot do this without public and private partnerships, and we recognize that. So that's how we came to this place. That's all. So with that in mind, we talked about how we're going to get our staff involved. So we start with, we're going to be guided by our vision, which is in you. We'll be guided by our vision. which is to establish a strategic priority that aligns with our vision to be leading and preferred healthcare providers in the Virgin Islands and the region. So that will align with our mission, which is to deliver comprehensive, client-centered patient care. And to do that, we want to unify all our work priorities to do it. So with that, we want to work on cross-functional collaboration, foster a cohesive environment, empower each other in the roles that goes towards collective success. And we're going to do that by laying out the foundation for change. The strategic plan lays the foundation for the strategic priorities to follow. These priorities and themes represent the pillars of our future growth and our innovation for the next 5 to 8 years. What I like is that the strategic plan is a living document. It won't just be one piece of paper and this is it. We will flex as we get exposed to different things and move forward. So that's where we are going forward. Thank you.
Thank you, Mrs. Malone-Smith. Ladies and gentlemen, after 10 stakeholder focus groups, 2 town hall sessions, 4 community sessions held, 2 visits to the sister islands, and 1 major public survey, we are now here at the priorities identified by staff and the community at large, and also with our stakeholders. Their expectation from the BVI Health Services Authority's strategic plan. And at this time, as we wind down, we want to introduce you to the priorities coming out of those consultations. We believe they're comprehensive, and we believe that they will serve for a healthier Virgin Islands. With that, I'm going to invite our Director of Quality, Rhonda Williams, to introduce the first priorities.
Good afternoon. I established the protocol that has already been established. Good afternoon again. My goal is to talk about the first strategic pillar, which is stronger governance. When we talk about governance, just a quick definition, it just talks simply about systems and processes. And that's what we want to make sure that we have in place at the BVIHSA, and whatever we do not have in place, we make them stronger. So that's one of our strategic pillars, stronger governance. And the objective is to reinforce leadership stability, ensure safe, high quality care through strong, accountable, and transparent governance. We want to make sure that we stay in alignment with the Ministry of Health and Social Development. We want to formalize and embed our clinical and governance across the organization and make clinical governance a part of our daily work. We want to make sure that we strengthen that link as well with our NHI providers and make sure that that links with our staff's responsibility in terms of their performance. We also want to talk about data and discovery. And what the objective is to just enhance using data to strengthen any clinical or non-clinical decisions and practices, and to build our internal capacity to address our community health needs. So in a nutshell, that's what I'll be tasked with. Thank you.
The highlights are to introduce you to the strategic priorities coming out of the plan. We wanted you to have a copy of the plan so you can take it with you today and go through it. Remember, it's a live document, so feel free to reach out to us if you have any concerns. Introducing our next strategic priority will be Dr. Annalise Wilkins.
Good afternoon, everybody, and I acknowledge the established protocol. Good afternoon again. So I'm talking to you about smarter care delivery. So moving on from robust governance, that then provides the framework to deliver enhanced patient care or smarter care delivery. So this is based on setting standards to ensure high quality and, most essentially, patient-centred care. So engaging the communities we serve, building that trust, actively listening and enabling transparent two-way communication so we can align our services with the dynamic needs of the population that we serve. So to deliver excellence in clinical care, we must focus on an outcome-based care model, fully utilising the digital-based systems that we already have in place, such as our electronic health record, and that will enable us to continue to standardise systems and patient pathways and develop our monitoring processes. This also introduces accountability. So with patient safety as the major focus of that, and what's reinforced in this plan is the importance of full staff engagement in this process, but while also recognising the need for support and training and the incentives to fully enable that. And all this brings us back to our central focus, the patient. So acknowledging that they also play a vital role in their own care. And we as an organisation, a profession actually, have a responsibility to promote prevention, enhance health education, and thus empowering our patients with their own voice and equipping them with the knowledge to facilitate and engage in a shared model of care. But on the foundations of trust in robust and standardised systems that then ensure their safety and also the excellence in the clinical care outcomes that we're striving for. So that's what this pillar of the plan speaks to, and that will be part of my responsibility.
Thank you, Dr. Wilkins. Our next strategic priority is workforce development. And this is a key one because we want our BVIHSA family to know how much we are about to invest in you. New money, yay! So please put your hands together and welcome our HR manager and deputy HR manager, Dr. Deirdre Wheatley and Mrs. Kishma Chalwell Williams Chalwell.
Good day. Acknowledging the protocol already established, I say to all, good afternoon. It is a pleasure to be here to represent what is, I would deem, the most important part of our work plan moving forward, and that is representing how we will ensure that our workforce is ready for the future that is to come. We can't speak about any of the other facets of this work plan without thinking about the people that actually have to carry it out. And the way that we prepare to have those people ready is to consider the learning and development needs of those individuals, in addition to the recruitment and retention strategies that we have, as well as ensuring that we adequately compensate people for the work they do and that they will do. So, as a part of our contribution to the strategic plan, we plan to ensure that we launch a comprehensive compensation review that we will hope that will encourage and increase the engagement of our current workforce, in addition to helping us to recruit the best and brightest. We can't pretend that we're going to recruit the best if we don't have a compensation package that takes into consideration the entire human that comes to us to work. Wellness including not just the monetary values, but as well as the non-monetary benefits that people can receive and that should be considered as the staff, incoming as well as to keep the ones that we actually do have.
Okay, so today, good afternoon everyone. So today I will be going through our three goals that will help us get to where we need to be within the next 8 to 10 years. So the first goal will be building a motivated, supported, and stable workforce by offering competitive compensation, transparent recognition, and effective onboarding and retention strategies. Another goal will be equip the workforce with the right skills and capabilities to meet current and future service demands through targeted development and strategic workforce planning. And our last goal, and hopefully not the least goal, is to create a culture of accountability, strong leadership, and holistic support by aligning performance systems, empowering managers, and promoting staff wellness.
Thank you.
Thank you.
For detailed information, you can find us on page 15 in your plan.
I'm going to introduce infrastructure pillar. Because the infrastructure, this is where we're going to do our work. And it needs to be maintained and grow out. As we grow, it may need to grow. So we need to have a firm plan for that. So the goals for infrastructure are to upgrade the infrastructure, improve air quality, ensure effective facilities, maintenance to support staff well-being and service delivery, and also to ensure the infrastructure team has the right skills and staffing to meet operational demands. Because one of the things this is Pat speaking, is we're very good at building, but we need to get to the place of maintenance, and preventive maintenance is one of the things I want us to get a whole lot better at. This goal will help us get to the place where we can work on saying that, okay, this equipment, like you heard the chairman talk about, doing life cycle reviews of our products to make sure that we purchase it knowing that it has a life cycle of 10 years. So with that being the case, I know that going into year 6 or 7, I need to start planning, how am I going to replace this? We do currently, not just us, other organizations don't do that. We wait till it breaks and we say, oh snap. We don't want to do that anymore. We want to be ready, preventive maintenance, and always ready to deliver the care that the patients need. So that's one of the reasons we're working on the modern infrastructure, and these 2 goals are the ones we're going to be monitoring for the next 5 to 7 years. Thank you.
Thank you, Mrs. Malone-Smith. What is also key for us to highlight is that some of the work we have already started on some of the work. The chairman mentioned the agreement with the RDA, which is facilitating the renovation of the major people's wing of the building, which will house our clinic and specialty services. So some of the work started already, and we are going to continue with that. Next, we're going to welcome to the podium our Director for Enterprise and Security to speak to our strategic priority, digital innovation. Please put your hands together and welcome Mr. Mikey Ferrara.
Good afternoon, everyone. Good afternoon. I acknowledge the established protocol. So I'm going to focus on digital innovation. For the last few years, we've been focusing on developing our health information system within the DDoS hospital, as well as to the clinic. So it's one centralized system that keeps the patient record. What we're looking at doing in the next few years is expanding services, additional services to the outer islands. So, example, on Anegada, you have a doctor going on Monday, Wednesdays, and Fridays. So, am I not to get sick on Tuesdays and Thursdays? So, we're looking at delivering, making doctors available for 7 days a week, because here it's 24/7. So, we should be able to make doctors from here available to the outer locations, that's in the 3 outer islands. But what it also brings is additional specialized services as well. And that's key, because there are instances where individuals might be told to travel to come to see a doctor here on Totola, but then the doctor, after looking at them, saying, well, you didn't have to come. So by offering those specialty services, we will help them to save money. But then we would also save money on travel costs in terms of our doctors going across to the outer islands. So telemedicine is key in terms of that initiative. Next initiative that we're going to look at is artificial intelligence. Everyone's hearing about AI, right? Many of you use Copilot, DeepSeek, and so forth. But AI plays a key role in health, especially in radiology, where by looking at the different charts and so forth, it can detect what might happen to you in the future in terms of future illnesses. So AI is pretty much the way of the future in terms of helping to deliver better healthcare. Now, it's going to take a few years, so we're going to slowly integrate it, first looking at doing it within the health information system, and then becoming more sophisticated as we go along. Now, if you're not aware, China is ahead of everyone when it comes to AI. China just introduced a hospital, 12 AI doctors, 4 AI nurses, and see 10,000 patients a day. That is fascinating. So that is what we're going to look at down the road in the future, how we could deliver that kind of service. Because we're always talking about wait time, how we could reduce wait time, right? You don't have to worry about them calling sick. I want a raise. You're working me too hard, So it is the way of the future, right? Right? Now that we've talked about AI and we've spoken about telemedicine, one of the key questions in which we can use to sell ourselves is, okay, we've done all this stuff in terms of technology, but is your information safe? So what we're looking at is what we call ISO 27001 certification, which focuses on information system security, right? So in the last few years, we've heard the minister talk about we've achieved certification. So we've achieved ISO 9001, which says that which basically focuses on quality healthcare. So now we have the quality healthcare. So the next step is your patient information safe? And that's what ISO 27001 is going to do for us. Okay? And those are the 3 areas that we're going to focus on. All right, thank you.
Now, I don't know about you. I will only trust the AI doctor after he practices on my king. Honorable Dawson, I'm sure you're proud as a former chairman of the board to see us finally taking steps towards the implementation of our strategic plan. It's been in discussion for some time. Next, we're going to re-invite to the lectern Dr. June Samuel. Dr. Samuel is going to talk about our resilience. She will also talk about our financial strength and our strategic partnerships.
Okay, so of course, all of this needs financial strength to get there, right? And on the pillar of financial strength, we are going to be using informed financial planning. Most importantly, we're going to diversify our income streams. And we are going to enable financial management transformation across the organization. We're going to be looking at cost efficiency. We're going to be looking at reduction of wastage. And we're going to look at being able to actively manage our inventory systems. Under the area of diversifying of income streams, you would have heard Chairman Potter mention some of what we're doing to enable us to be able to help us with that in ensuring that we get our 501c3 status completed. We're going to be designing and launching new private care services, and we're going to be looking at the market to see what are the areas of opportunity that we can tap into to help us with our income streams. We are looking towards becoming financially, we have to have a financially sustainable organization, but we must also reduce our reliance on central government. Partnerships also, which is pillar 8, and in your books it's on page 20, in case you're following. But partnerships will help us to achieve the goal of strengthening our emergency responses and service delivery. It will help us promoting our preventative care and wellness services. You would have heard of our cancer conference that we had a few weeks ago in collaboration with the Cancer Society. So you will be hearing more about those types of collaborations. And we're also going to be looking at developing revenue-generating health and wellness initiatives. We have a nice gym upstairs, just in case anybody wants to sign up. And our organization must be resilient and sustainable. So we have to ensure that we can continuously provide health care and reduce all of our long-term risks by ensuring that we look at reducing environmental impact across our healthcare operations. We're going to increase the workforce awareness of our capabilities around resilience and sustainability. And we're going to ensure readiness and response capabilities through structured plans, training, and resource allocation. So obviously, as the only public health care facility that has to respond during all emergencies, we have to ensure that we are always ready to respond and that all of our plans are correct. And so those are all of the pillars. You can find them in your nice handout. I want to point out that the handout that you have is the public document. There are strategic briefs that go into more depth. We also will have or do have plans that speak to change management, communications, or implementation plan. And so over the next few weeks, we will be working on preparing to move forward with implementation. We are in the process of ensuring that we have a project manager, who can make sure that we implement the plan. Okay, implementation is going to be a lot of work. It's going to be collaborative and across the board. In addition to that, we have our monitoring and evaluation tool. So we have to know how we're doing. Okay, we've come up with this nice plan, pretty document, but we have to monitor the implementation, and we have KPIs that have been developed for all of the pillars so that we can look at our progress and ensure that we meet our goals. So as we move forward, I'm going to hand you over to Mr. Grange for the final section of our activity today. So we have already begun the progress towards transformation by having new partnerships. So you're going to hear about our ambassadors and new tools. So Mr. Grange, where is he? Is going to take us through that part of our program.
Ta-da! Ladies and gentlemen, thank you, Dr. Samuel, for that inspiring presentation. Ladies and gentlemen, as part of our new look, the BVIHSA has been working in the background to put digital healthcare closer to the people we serve. And so we have developed an exciting website, and we want you to take a look because today we officially launch our brand new website. While Nigel is getting the video ready, as part of our digital footprint, we are also excited to announce the launch of our BVIHSA patient portal. This will bring medical services to your telephone. Yes, thanks. Clap for us.
Access to medical services, department contacts, and essential health updates. Need to find a clinic, reach a doctor, or understand your care options? It's all right here. Explore service.
So in the meantime, I'll tell you a little about our patient portal. This is, you can even scan your QR code and register today for the BVIHSA patient portal. You'll have access to your medical reports, medical records. You'll have access to your lab results. You'll have easy access to request appointments, and also you can request medical reports from your patient portal. And as we go, the services will be extended. You can also, this is very important, especially as we work on our revenue streams. Guess what? You no longer have to come to the hospital to pay your medical bill, because you can now pay your bill via the patient portal. So it's, yes, clap, thank you. So, because you know what? Once again, Nigel, the reality is, a lot of folks are willing to pay their medical bills, but sometimes it's inconvenient for them to drive out and come to the hospital to pay the bill. And it's not a service that we can cut off, so there is no great urgency. But now we're making it easier for our clients to be able to pay their bills, request appointments, and request medical reports, and also check their history, their lab results, and so on, right at your fingertips. And we're now active, we're live as of today. You can scan the QR code or go to... Good job, Team BVIHSA, or go to our BVIHSA website and register. You ready, Nigel? Yeah. All right, go ahead.
The BVI Health Services Authority is proud to welcome you to our new digital home, www.bvihsa.vg. Designed with you in mind, our website puts excellence at your fingertips with quick access to medical services, department contacts, and essential health updates. Need to find a clinic, reach a doctor, or understand your care options? It's all right here. Explore service directories, health alerts, and helpful forms anytime, anywhere. You can now purchase over-the-counter medication online and pick it up at our outpatient pharmacy. Convenient, secure, and efficient. Whether you're a patient, a visitor, or a healthcare professional, this is your gateway to smarter care. It's modern, it's responsive, and it's built to serve. Visit us today at www.bvihsa.vg. The British Virgin Islands Health Services Authority, committed to your health and to excellence at your fingertips.
Yes, so we begin with large. And this is part of taking the BVIHSA regional, because I don't know if most of you are aware, but we have some of the most modern equipment anywhere in the region. And we are one of, in fact, the only in the Eastern Caribbean internationally certified, as you can see. We're DNV certified, so we're an accredited organization, which means we can now collect money from our global clients and our global insurance partners. And this is a big deal. BVIHSA is doing great things. Put your hands together for us. And something that we are deliciously proud of is that we are here for you, and we have been here for over 100 years. BVI, this is something to celebrate. And when you think about where we have been coming, where we came from the two-room cottage hospital to this monstrosity on the hillside that is admired by the world, and that even the UK was a little jealous when they saw it went up. But they have gotten over it since. We have come a long way. That's all I'm saying. So one more time, give it up for BVIHSA, our new look, new mission, our strategic focus. This is deliberate building of a sustainable health system that will serve the BVI people for generations to come. And that is to be celebrated. With that, we have solicited the help of some of our community partners. And as part of our extended reach and building a link with our community, we have launched as well our brand new BVIHSA Ambassador Program. So now we're taking nothing for granted. We're saying we want you to be a champion of BVIHSA, and we want to make it official. And so we have some of our ambassadors here today. Some were unable to make it because of prior engagements. But Dr. Samuel is going to come, and we're going to introduce the ones that are here to you and officially brand them BVIHSA ambassadors.
All right, so ambassadors are important people, and this came about after our senior elder doctor, who happens not to be here, had a conversation with me, and we were talking about how can we solicit and have reach to those persons beyond my reach. Other people have access, because we of course have to have a strong fundraising arm. And so we came up with this idea of, Damien's idea actually, having an ambassador program. And so our ambassadors, we're going to pin the ones that are here today. Damien will name the whole group. We'll pin the others when they are available. But they will be working very closely with our business development committee. We have an in-house business development manager. And their role is to assist us with sourcing areas of funding, sourcing donors, helping to collaborate with persons who are interested in working with the BVIHSA and taking its mission forward. So we're very proud to announce the persons who are here. We're going to start with Mrs. Violet Gore. You want them to do it individually?
Yes.
So each ambassador will be taking a pledge, and then we will pin them.
Don't stick me. Ahead. As a BVIHSA ambassador, I pledge to serve with pride, respect, and integrity. I will represent this authority with professionalism, positivity, and purpose. Though I do not provide clinical care, I understand the trust placed in me to reflect our mission. I commit to leading by example because in all we do, only excellence counts. Thank you. Thank you, Dr. Sandy. Oh.
Can you just act like you're pinning her?
Oh, act like I'm pinning her. Oh,
Right.
missed that?
No, well, yeah, you guys were behind the mic.
Okay.
Sorry. Look at me now. There. Thank you. Hey, you're okay.
Our next ambassador is Pastor Jovan Klein. Woo!
As a BVIHSA ambassador, I pledge to serve with pride, respect, and integrity. I represent this authority with professionalism, positivity, and purpose. Though I do not provide clinical care, I understand the trust placed in me to reflect our mission. I commit to leading by example because in all we do, only excellence counts.
Nice job.
Thank you, Pastor Javon. Can you pin again, please? There we go. Okay.
Thank you, Pastor Klein. And our third ambassador who is here is Mrs. Rosemary Flatts.
As a BVIHSA ambassador, I pledge to serve with pride, respect, and integrity. I will represent this authority with professionalism, positivity, and purpose. Though I do not provide clinical care, I understand the trust placed in me to reflect our mission. I commit to leading by example because in all we do, only excellence counts.
So we want to say thank you to those persons who have agreed to be our ambassadors. Mr. Grange will name the other ambassadors as soon as he comes here, who couldn't be here today. And we look forward to working with them. We will be establishing our fundraising committee shortly, and they will be working with that committee to help us with seeking out donations.
I'll just add that the role of the ambassador is extensive, and each ambassador received a packet which will define the role. There's a code of conduct and a training manual in the packet. So we're not taking anything for granted. But we are so grateful that these lovely community stalwarts have agreed to support the BVIHSA. They are now our community defenders of brand BVIHSA. and they will also help us to improve. Because from the outside, they are going to hold us accountable to especially our commitment to you today. And I would like to say our patron ambassadors are our governor and his wife, Governor Daniel Proust, and we have Sharon Flax Brutus. We had some young people, but we were unable to confirm them, but we are going to work on that. We have Dr. Deolanda Smith, the hospital's namesake, and Dr. Kedrick Pickering. Dr. Kedrick Pickering has been a champion of BVIHSA. And like Dr. Samuel mentioned, it started with him because we needed to extend our ability to store and provide blood services in our lab. And he was talking at the Rotary Club. And then he mentioned that this would be a key help for the organization. And through him, the Rotary Club was able to make a substantial donation, a contribution that increased our capacity 100%. So we believe with people like him and these stalwarts working to support brand BVIHSA that we can only grow and get better. So put your hands together for our ambassadors. Ladies and gentlemen, thank you so much for your time. We know you're busy. Our elected officials, we're grateful that you took the time to be with us. Honorable Wheatley, thank you for always being here. We just appreciate that. Thank you, Chairman, for all the work you do. I know you're smiling because you're happy to see us at this point. Put your hands together for KPMG. If the KPMG team is sane after today, then they will be sane for the rest of their lives. Ladies and gentlemen, I also want to extend a big thank you to our media partners for always amplifying our voice. Kathy, you are here always helping us to get our message out, and we appreciate you and love you. So thank you so much. Ladies and gentlemen, ambassadors, we look forward to working with you. Oh, well, he knew he has to earn his take. So after the next press conference, then it's official. You've been helping us too, right? So thank you so much. We appreciate each of you. Ladies and gentlemen, thank you so much. Help us to spread the word. And this is a brand new BVI Health Services Authority working for a healthier BVI. God bless you.